Hello, everyone, and welcome to the live Q&A session of day 2 of our rerun for the Pet Pain Relief Summit. And I'm glad that everybody's with us today, and hopefully you've enjoyed the sessions that you listened to today, whether it was for the first time or a repeat. First off, I want to thank our sponsors. We've got Turmeric Life, and if you haven't been introduced to that yet, we're going to have a presentation from Dr. English here in another day or so. His products are really well tested. He's got powders and chews and biscuits and even things for humans. So take a look at that site. And then also we have Chi Dog as another sponsor. This is human grade, lightly cooked foods that are based on traditional Chinese medicine philosophy. And those recipes are very digestible and they can work in different seasons and for different conditions of your dog. So take a look at their site as well and support them. We really appreciate what they do to help keep these programs coming to you. All righty, so today what we had, let's see, we were looking at external approaches, things that you could do topically, whether it's salves, hot packs, cold packs, different therapeutic modalities, exercises, things like that, how we can reduce pain by improving the body from that direction. So we had essential oils. That's where we started off with Dr. Janet. And then we got with Laurie Edge Hughes. She's always so much fun, the PT from Canada. And she was showing some different exercise things that you can do to help reduce that chronic pain. And then Dr. Ross shared a whole plethora, really interesting time with her of different herbs, things that she's used, successes she's had in different devices. So that was really fun. And then visit with Dr. Ruth Roberts. We talked about, her topic was about the fact that you can see a problem with your animal at home. And then when you go to the veterinarian, because of different environment, the situation at hand, they can't really see what's going on. So you may have a lameness, but then when you get there, they tell you, nah, there's nothing wrong. But you know that there is something wrong. So we kind of visited about that and how to help you navigate through those difficult times and conversations when you know that you know what you know about your animal. All righty, so that's our grouping of what we want to cover then tonight. And any questions you have, or come up with something else you thought about from yesterday's programs and you just didn't get in there, get your question entered in, then we can we can handle that tonight too. So we've got roughly 55 minutes or so. So let's just go ahead and jump on in there. What have you got going? If we don't have any questions yet, I'll go ahead and put a little promo in there for our next program, which is the Life Extend method. So this would be programs that are put together by myself, and they're programs that you wouldn't have seen already on any of these others. They're unique to this Life Extend method program that we're going to have. So you can join in on that. It'll be another rerun, but we will have a live Q&A with that afterwards too. And it gives you time over the course of a month to get all of the sessions watched. So you're not having to do it one day, hours a day for several days a week. You can do it at your own leisure. And then we get together then at a point in time about a month or so at the end of that. So that'll be a whole lot of fun. There's programs there that you won't see anywhere else. I put together one on cancer, and I was really excited about all the information I found and the way I was able to present that. So a lot of different things in that program. Alrighty, we got any questions coming down the pike? You can even make a comment on what you enjoyed. Yeah, you really like Dr. Hughes. Big thanks to her. Yeah, we appreciate all those kudos too, because they put a lot of time in on putting those topics together, making the video or being available for a live presentation. A lot of time is invested in doing that. And so nobody gets paid for this. It's just our interest in wanting everybody else to know what we know and being able to help more animals out there than just the ones we might see in our clinics or office or house calls or however it works for everybody. All right, this is a 2-year-old golden retriever that itches a lot, mostly behind her elbows. Okay, a 2-year-old. Now, the interesting thing about the elbow, so sarcoptic mites, if your dog was like maybe went to a boarding place or had been around some other dogs, this is just one thing. We see it a lot in especially young dogs, but it can happen. I've seen some older ones with it too. The sarcoptic mange mite, they actually are attracted to the elbows, the edges of the ears, on the pinnas. They'll get little scabby, crusty. They'll be itchy. But the elbows, it's kind of funny with that mite, they'll show up on the elbows first. They'll also get some along the sides of their abdomen and chest, but it doesn't have those itchy sores along the top of the back unless it goes on and on and on and on. So elbow itching, the first thing I'd be wanting to check would be make sure that that's not a possibility. Being 2 years old, she might have been somewhere. But the thing about the sarcoptic mites is that they have to be around another animal that has them to get them. It's not like the Demodex where you get it when you're born. Everybody has a mite, and then when your immune system drops, has to drop a lot. Then those mites may be able to be seen. They kind of like overgrow at that point, and then they'll show up on a skin scrape. But that's an immune suppression mite that is there but kept under uh, check unless the immune system drops off. But the sarcoptic mite is a contagious mite that you get from being around some other animal. It doesn't necessarily have to be a dog. It could be some other species maybe that had their type of that sarcoptic mite too. So that would be one thing, depending on how long she's had it. Hair loss in the area. Yeah. So other than that, that's where I'd start with ruling out what it could be. Things that you can do, certainly you want to get to what's the real reason this is happening. So I would look at maybe there's some place where she sits with her elbows down and that tends to get irritated, maybe something in the grass or someplace where she lies, looking for something there. Topically, aloe vera is really good. You can get some topical lidocaine spray. You can use different herbal sprays that can help that too, cool compresses. Yeah, there's a lot of different options there topically. Also, if it's really bad, you can go to the Cord Aid, but it doesn't sound like you're to that point yet. So hopefully you're watching tonight and that'll help you. Okay. You know why I think that was? So your questions about the toothpaste and the free ebook. I think that's because I was thinking of the one that came out with the senior dog, which is the mouth to bum one, and that one has the teeth recipe in there. Um, so this one was about pain, so that one didn't have the recipes. But if they're not on my website, you can give me an email and I can, pull them up and give them to you. But yeah, or what you're saying is put them on a chat group page. I'll see about doing that too. You can email me and I'll give it to you and then you can put it on the page. Or I'll give it to Gindi and maybe she can put it on the page for us. All right, I'll get them to you. I'll write myself a note. All righty, there we go. I got myself a note. I'll do something about that. All righty, cool. How do we know the essential oil we want to buy is of good quality? Probably the reputation of the company. So like doTERRA is a very high quality. And if you go to that website and you look at their philosophy, you look at the help that they give to the communities where they work for all over the world, they'll help the people there be able to not only harvest, but there was one situation where the people had to go a long ways to get the water that's needed for the pots and the situation for the extraction process. And so they helped them with getting a well close to where they were, and they do a lot that way. So I would look at the websites of the information of the companies. Like if you buy a product that's like through Amazon or some secondhand place, you may not then be able to ascertain the quality, but then that would be a concern. So Young Living, they've been out there a long time too. They're harvesting and what they do with their products. And they're making sure that there aren't any other perfumes. It hasn't been adulterated. The quality of the product they get in is what it should be. So those are to the tops. And I'm sure there's some other ones out there too, but I really appreciate the humanity aspect of what doTERRA does for the whole world. All righty. So here's a female golden, had to have surgery to remove bladder stones. Okay. Yeah, certainly any type of inflammation or itis going on in the bladder can certainly lead to bacteria, which can add to the problem. But the reason for the stones to begin with has to do with that individual. So whether it's a cat or a dog or whoever it is, that the levels of, and we're not talking blood, we're talking in the fluid that bathes all the cells. So the interstitial fluid, the levels of calcium and magnesium and phosphorus are not where they should be. So you have to have enough. First off, the pH of the body has to be one way or the other. So really high alkaline pH makes the struvite stones. Really low pH, acidic pH, makes the oxalate type stones. And then we have to have enough magnesium to keep that calcium in solution. Otherwise, it precipitates out. And with the calcium, then it's going to be the phosphorus, the magnesium that makes up those stones. So the real underlying thing, while bacteria will come along once there's inflammation and once the cells lining the bladder have been irritated enough and that it's not healthy bladder wall, sure, bacteria then can overgrow. And you certainly can sometimes have bacteria in the middle of a stone. A stone basically is like a pearl developing inside a mollusk that it keeps putting on layers and layers. But all of this originates because of generally deficient magnesium to begin with, and then the wrong pH and the calcium's not kept in solution. So the way you really find out about that is by doing a hair tissue mineral analysis test, and you find out what the ratio of the calcium to the magnesium and is where the magnesium level is. So that gives you the real true start. And then you can follow that. And that's how those stones are going to go away. And I've done that multiple times with dogs. And before I knew about doing TMA and before my decades of working with it, I would have been on this same path of looking for a prescription diet, which yeah, as you read the label, there's not a whole lot of good things in there. And generally, they're very high in carbohydrates. So then what happens is the animal starts to become overweight. Now, I can say that in really bad situations, even now, sometimes I'll still have somebody use that for a while because they can be very beneficial to some degree, but not in the long term for the overall health of that individual. So starting out for a little bit, okay, while you're getting everything else going, then after a while you can wean off of it. Yeah, so sometimes doing raw diet, especially depending on the size of the dog, how big they are, it can be pretty pricey. I can say the one thing about Yum Woof, which they have the air dried pellets in there, and they also have so they have the new little round, like BB sized air dried pellets. And it doesn't take very much. My 50-pound dog only gets like 2/3 of a cup of that, which is an air dried food. So I'll do that and then sometimes do the raw as well or do bake. She gets a variety of different things, sometimes the home cooked. But at any rate, it is not very expensive in the long run because they don't. 50-pound dog, 2/3 of a cup, that's not very much. A bag lasts a long time. And then they also have a premix that you can add your own meat in. So that would be an option. Raised Right, I know now, has created some specific veterinary type specific for disease problems. So they do have a renal diet that's just come out in the past few weeks. Working with Dr. Karen Becker through, she works with that the company, so they've expanded on that. So that might be another thing too to help you. And there's so many different raw diets out there now that are prepared. So there certainly is a large price range. And sometimes you can find some local companies too that aren't as expensive because they don't have all of the advertising costs, depending on where you live. So some of it's going to be though consistency on the part because of the bladder stones, and then definitely finding out where the mineral tissue levels are, because that's going to help you in balancing that so it doesn't happen again. That's the thing. If you don't do something different and find out the real why, then you're stuck in that happening again and again and repeating the same scenario, which I know you definitely don't want. Okay, so the question is, what's the best way to get rid of a mild staph pyoderma? It's a 16-pound Yorkie started because of flea bite dermatitis. Okay, so you could have the flea bites that irritate the skin enough that the bacteria kind of, the skin gets irritated, but also the pH has to be just right and the immune system is not that strong. Otherwise, the staph wouldn't happen. So then we got the allergic bacterial fungal infection from biting and scratching. Okay. Yeah, I know the Duo D3. Yep. Yep, the shirt helps to prevent the scratching. Sensitive to essential oils and soapy shampoos. Okay, irritated skin. Well, it sounds like you kind of got on it, like you've got a plan going that's working for you. Um, and maybe what you're asking is this going to happen again? So certainly your thing is going to be keeping the fleas off. And if he's hypersensitive essential oils, you're going to be more limited on what you can apply that's safe as opposed to a chemical. But there are some products out there that are water-based chrysanthemum, which is where the original pyrethrins came from. I think it was Farnham, Farnam, used to have a product called Equisect, but it's a water-based, even though that's like horse, it's also safe on dogs and cats. And it's organic chrysanthemum water-based spray. So that would be one thing, keeping the fleas off. And then you can also use like things for the sensitive skin, topical aloe vera. There's other products like that that are made that have calendula in them. Arnica is always good for getting that irritation down. So part of it would have been, here's another problem. There's that a flea can feed up to 200 times in a day. Can you believe that? One flea. So one flea could make a dog go ballistic. And then I've seen dogs that had 20, 30, 50 fleas, and they weren't hardly agitated by them at all. If I never got that one. But any rate, so it doesn't take much of a flea in how many times they can feed in a day that could cause a whole lot of irritation. But being able to get something on there really quick before they go crazy about it, keeping them cool, chilling that skin can help a little bit too. So a cool compress, and then getting a topical on there, the lidocaine, the arnica, something to stop that early inflammation and itching. So you might look at the homeopathic approach like the arnica and see how that works for you. All right, so here's somebody who adopted a senior dog. Thank you for that. Only 5 pounds. She was a stray. Yeah, and then probably had a lot of vaccinations that maybe she didn't need. Transferred to and then she got a rabies. So this is all like really close together. Had a lot of teeth pulled and when they were cleaned. So yeah, okay. So maybe some low grade bacteria already there before all that happened. And then, so she is coughing. Now, the coughing could potentially be because of the trach tube. So they're intubated when they have a dental. And so just that. So the infection in the mouth, for one thing, already could have caused a problem. And if they didn't give her some kind of antimicrobial or something for a little while, it could gravitate down. But also they're intubated when they're anesthetized, and that can make them cough for a little while. Can you put that back up again so I can see what the last of the sentence was? Um, okay, so your doctor on the 29th of October. Okay, so, and she's been, let me see the teeth. Okay, so yeah, okay. So the cough, oh, you have that irritation by being intubated. Yeah, okay, so it's already on there. That's funny. I started saying about that. Generally, if it's kennel cough, it's going to be more prolonged and more deep. And then after a while, they start feeling ill. If it's a lighter cough, especially if it's aggravated with exercise, it could just be from the tube being there. But and that cough and can last for 3 or 4 weeks, maybe even up to 6 weeks, but it should get less and less and less from the trach tube. But there are some of the different herbal um, like throat protectants and things for people that would be safe for a dog to help with that coughing too. And sometimes just to stop the cough irritation, you can use cough suppressants like for people. You just have to get a very, very small dose. It's only going to be a few drops because she's only 5 pounds. So that would be another option to get that cough subsiding. But if it's really the kennel cough, she'll go on and on until it becomes like bronchopneumonia or something like that. So she'd be feeling worse. So otherwise, she should be feeling better. You've been giving her manuka honey. Yeah, sometimes that works. As long as the it's not a bacterial thing or something that where they enjoy the honey, something. But if the manuka seems to be working for you, then that's fine. Another thing you could think about, there is that oral mouth spray that's by New Zealand Deer Velvet. And that is very antimicrobial too. So you can spray it on their mouth, but they're going to swallow it and then it'll move across the tissue there in the throat area. And so that might be another option. MediHerb has a product called Broncheffect, which are herbs that help with any kind of a bronchial situation that where it's like a bronchitis, if that was the situation there for her. So a lot of different factors, and I'm sure her immune suppression from all of those vaccines. Another thing is just going to be boosting her immune system for a little while. So you can use the transfer factor, Vengeance, VENJENZ, and that product was originally developed from Dr. Will Faulkner. And so he works with the Vengeance company, and they've got this perfected, and it's in a liquid form. So that's really, really good about boosting the immune system. Safest flea and tick guard for a new puppy. Okay, so I'm guessing because it says pups that you mean it's a young animal, a young dog. And are you wanting this because they actually live where you have a problem with fleas and ticks, or are you just wanting something to put on them so that if you go out somewhere, in case they are exposed, that you have something available? That's kind of like two different reasons why you might want it. Because if you're just doing it prophylactically, and you don't really have a problem, then there's a lot of different things you can do. There's some companies that have some of these sonar chips, like it's a little tag. I've had some good results with those, and I've known some people that have used those. So that's one thing. Certainly, if they're not sensitive to the oils, you can use a blend of different essential oils to help with that. And Dr. Janet certainly has some different blends on her site, and she tells you how to mix them up on those concoctions. So that would be another option there. That Equisect I just mentioned, which is the chrysanthemum. So that one's safe form. What you want to avoid is any of those month-long or something that's good for 2 months or 4 months. Those are very, very toxic. And it's going to shorten the lifetime and lead into other disease problems for your pups. So stay away from all of those chemical related type. If you are confronted by it or you think you're cornered into it because the situation is so bad, certainly Google it up and use it only for a short time, but look at Google and look at the side effects. So if something does happen, you know what caused it. And then as far as the fleas and ticks, if you have fleas, then you really need to get your environment treated. Fleas they're going to move out to the periphery indoors. They're going to be around baseboards, under furniture. So you need to get the environment treated for the fleas. They'll live in dust bowls, under bushes, out in front of the house. But you can eliminate the flea environment a whole lot easier than you can the ticks, because they're going to be out in the woods, and that's going to be much more of a challenge. And then also, like, using a flea comb every day. When you come back from hiking, make sure and check the dogs really good, comb them out, look real good for any new ticks that have fallen on them that haven't yet attached. Of course, easier with short-haired dogs than the long-haired, but there are a lot of different things you can do in that respect. All right, Rose asked, would arthritis in the hips and knees in a cat cause twitching in the skin on the back? Okay, so here's what I think the process would be on that. So the answer is going to be yes, indirectly. So because of the arthritis in the knees and the hips, that's created a change in posture in the cat than what it would be without that. And so that then has changed the alignment of the vertebra in the back. So my first thing would be chiropractic adjustment. And there are cats that really, really, really do well once they've been adjusted. So I would look at that. So you can have that twitching, that nerve tingling. It's a dermatomal response. That's what it's called. And can be called hyperesthesia. And there's different reasons, like the hyperesthesia can be like super common if they have arthritis. But this dermatomal response, which is also a twitching, is an indicator that something below there, below that dermatome, that nerve area in the skin is altered. So chiropractically, number one. Number two would be maybe some laser once you know for sure what it is. But sometimes an adjustment or two and it changes that. And then also working with the joints, like helping, doing what you can, warming those joints, especially if it's an older cat. We're moving into winter here on the top half of the globe. And so having like uh, a heater blanket, an electric blanket that the cat can go get into, or some kind of a heating pad or something where they can go be warm and curl up. That's very, very helpful for them too. Yeah, I'd be looking beneath the surface and find out, but definitely the hip and knee problem has changed the posture, and that could be what then led to this. Thank you for that question. It's a good one. All right, Cheryl says, when you're utilizing multiple therapies, such as chiropractic, acupuncture, laser, PEMF, are there ones that are better paired together? I think sometimes you certainly can overdo it. What is the optimal spacing for maximal benefit? Okay, that's good too. The 12-year-old who's currently also swimming in hydrotherapy treadmill. Okay, so you're getting all of it. So I always like to start with the chiropractic because it's instantaneous change versus the acupuncture, which can be beneficial, but it takes more treatments in order for you to get to that point. So I like to help them and have something that's like instantaneous. So in order for any of that other to work as well as it can, we've got to get the joints moving again. So that's number one, to get the muscles able to have the signals from the nerves like they should be. So that's your base, and you may have a few treatments of that, and then that gets spaced out a little bit. You can utilize laser or PEMF. If you're doing both, it's probably an overkill. There's probably one of them that your animal responds to, and then the laser would depend on, are you doing the high intensity laser, so the class 4, like you go to the vet and you pay them and they do a 30-second treatment here and here and here and here. That versus the low level laser, which is something that you can do at home. So they're getting a little bit of it ongoing. And that is actually in some recent research shown to be even more effective than the high level laser. But you wouldn't necessarily need PEMF and laser both, depending on the style of laser that you had. If it was large enough to cover a large enough area, then you can make it easy on yourself. If it's just a small light, and you got to do a lot, then after a while, the animal, especially as they become feeling better, then they may go, enough of that. Why are you pestering me? I got something else to go do. Certainly the underwater treadmill is really, really good for the older ones that have trouble supporting themselves, like the gravity during life wears them down and they get sagging, especially if they already have some lordosis, that dip in their spine. So we talked a little bit about this yesterday, but the hydrotherapy, the treadmill, first off in that is getting them to walk right, making sure that they're walking perfectly before they speed up. So that part can be beneficial along with either the chiro or the acupuncture or the laser, because it's certainly different. Swimming is not the same benefit for a 12-year-old as the underwater treadmill would be, because I talked a little bit about it last night. When they swim, they work really hard in the front, and the rear legs are just little rudders. And so they're not getting range of motion. They're not opening up those joints. They're not getting the compression from the ground up, which is sending a message all the way up to the brain, and then letting the brain then realizes the body's doing something different and sends those other signals down, telling it what to do. So yeah, I think swimming is fine for younger ones, especially where you're wanting to build up cardio, but you can do the cardio for the older dogs with the walking. All right, he's getting the class 4 after chiro adjustments. Yeah. So if you're doing that, then I'm guessing then you might have been doing the PEMF at home in between those. I guess that kind of depends on how often you're getting your chiropractic adjustment. Sometimes for that age, once you get going, it's like maybe every 3 weeks or something like that. So if you're getting one laser treatment every 3 weeks and you're not doing low-level laser at home, then some kind of a PEMF at home could be beneficial. One of my favorites is the oh, Biomat's good, and then I got a mental blank. I'll think of it after a little bit. But at any rate, there are some of those that are animal designed and other ones that they'll just hog on the sofa if you leave yours out. So those can be helpful too, depending on the degree and the type. Alrighty, any insight on why a dog urine creates a white residue on the lawn when the urine dries? Okay, so you don't fertilize the lawn, but you see the change in there. So it has to do with the pH of the urine and then also what's actually in the urine. So the pH of it and then what might be, so like if there was any exudate, any residue, any other like crystal formation and things like that. But yeah, that's a problem. And certain dogs, and not necessarily male or female, but certain ones will irritate the lawn more than another. But usually it has to do with the pH level of that urine. All right, so we got a kitty cat, a Maine Coon mix, loses interest in eating. He's become a bit skinny these days. He's still active in hunting, but I'm more concerned about him getting skinny because he's not eating much, unlike before. So first thing from this history, I would want to know how old he is. He's active at hunting, so that means he does get to go outside. My other thing would be parasites. And it may be that he's gotten thin. So we're at the end of summer, depending on where you live. So has he been? I've seen a lot of cats that are very active during the summertime because they're outside more and they are doing the hunting and they don't eat their indoor food because they're eating the mice or the rabbits and the birds. And of course, they consume a lot of that other from them. So because their activity levels up, I've seen a lot of cats that live like that do lose the weight during the summer, even though they're eating really good, but they will lose weight. And then the wintertime when they're inside again and it's harder for them to have access to all those creatures because if you live in an area where it snows and it's really cold, then they're not out as much or the creatures aren't out and they're not as available. So then they end up eating more of their food again. So if he's fairly young and otherwise is healthy, it could be that scenario. And then during the wintertime, he'll gain weight. And then next summer, you'd be back to the same thing. But I definitely would want to make sure that he didn't pick up parasites. And you can have a fecal sample tested, and they'll be looking for cat parasites. But they also can get migrating larvae from the things that they eat or something else. Like they could get a parasite from a snail or a parasite from whatever, something in the water outside where they're at or in the mice or the whatever it was they were feeding on the bird. So they could get a parasite from some other creature. And yet you'll never find eggs because the cat is not the end stage host for that particular parasite. So the parasite can grow up to a larva stage, and that larva will migrate around inside the stranger's body, but because they're not an end stage host, it never becomes an adult, and you're never going to find those eggs in a stool sample or if they're doing the antigen testing, they won't match on their test for the cells of the body. So yeah, that becomes a bigger challenge than finding those. So a person who does bioresonance testing, like what I do, somebody that can test them in another way than just doing a fecal sample and find out if he actually picked up parasites from one of those creatures he enjoyed during the summertime. But I think about those two. If the problem is always that he doesn't want to eat in the morning and he's kind of slow to go and slow to eat in the morning or has tummy upset and he vomiting or something like that, and it happens in the morning, that always goes to a liver. So anything early in the day associated with nausea, inappetence, things like that is generally a liver indicator. It doesn't mean that liver disease So you could do a blood test and there's not destruction of liver. So the liver enzymes could be totally fine, but liver has like 1,500 jobs to do. So something else could be interfering and the liver's not quite right. So that would be my other take on a little bit more history about the Maine Cooner. All right. So what the fluff? Oh, isn't that cute? Yes, chiropractic is great for animals, and more chiropractors are offering it, although not always advertised. Okay. Yeah. So, oh, so you're saying, right, go to so you're a human chiropractor. So, to be certified in animal chiropractic, you can either be a human DC or a veterinarian. And then there are certified programs. And then there's the umbrella organization, so like the American Veterinary Chiropractic Association, and there's an International Veterinary Chiropractic Association. So a testing system then that validates that this doctor is trained and knows how to apply it. So you can actually go to AVCA, AV as in Veterinary Chiropractic Association, see AVCA doctors.com, and I think it's .com. It might be .org, but I think it's .com. And then there'll be a map, and then you can find certified animal chiropractors, so veterinarians or DCs that are certified that have been through the AVCA program. And then it's a map and it'll bring you into your area. You can find people that are close by. And I oftentimes send my clients, because I have people from all over the world, and I'll send them to the map and they can find out somebody in their area. And if they have several, then I just tell them to email me, and I can, might be somebody I know, or I can look at the info and then help them choose which one would be my recommendation to go to. Okay. All right. So your dog had an operation yesterday and she's leaking some clear fluid. You had a small lump on the front of his hind leg. All right. Between the hock and the wrist. Wait, his hind leg. Oh, okay. All righty. So it's in the metatarsal area. Bandaged. And today she went for a dressing change and the bandage very wet and swollen paw. Oh, well, sometimes when you don't take this away until I read the whole thing. Sometimes when a bandage is put on and if it doesn't go all the way down to the paw, it doesn't cover the toes, then you can get swelling of the paw. That would be one thing. Maybe the bandage was on a little bit tight, but it was good they checked it 24 hours later. That area generally doesn't have a whole lot of skin to close over. So sometimes if something is removed, especially if they were doing wide margins, then it is so tight there already from the sutures and not having a lot of flexible skin in that area, that the swelling can happen and the oozing can come on about because of that. The other thing I would say on this is that to get a low-level laser going on that, because if it's one where you can take the bandage off and put it on, if they can show you how to change it at home. And you may also want to, one of the things like that I've used a lot of, you can use sanitary pads because they're thicker and they'll help absorb, and so it won't leak through the bandage. Because as soon as that starts getting wet and leaking through, the dog wants to go licking at it. And the next thing you know, well, two things. Either one, you're not going to be sleeping at all because you're going to be laying there making sure the dog isn't licking its bandage and chewing it off, or they get a hold of it, they swallow it. Now you've got the bandage in the stomach. Okay, and said his paw would go down and it was, yeah. So I suspect some of that is why this is happening. But, like as a person, they'd have you keep your foot elevated, and that's a hard thing to do with a dog. So we've got the gravity moving down. Um, He now does not have a dressing on the site and is wearing a collar. Uh-huh. Yeah, I'd think about getting some of those thicker sanitary pads and doing a little thing like that, and to allow it to absorb some of that. I'm sure he's not happy about the collar, but it'll definitely keep him away from chewing it. And since the bandage is off, it'd be a perfect time for you to do that low level laser. Laser will speed up the healing process. You'll be amazed at how quickly that'll help. And you might also too, because you're in the first 72 hours, is do a little cool compress on that. You could do that to help as well, to help keep the swelling down. cool compress. Sorry about all that. It does happen. Hmm. Yeah, no, the fluid's not normal, but it is in the situation where in that area the skin's so tight and there wasn't enough to pull, and so that is part of the body's process to an injury. Oh, you're saying you got to wrap it when you take them out. Yeah. Oh, you could also get one of those sanitary pads and then get some little kids socks, and then or a tube sock depending on the size, and then you can pull that tube sock up over that sanitary pad, and then that's easy to take off, and you get multiple socks, and then you can launder them. I've done that a lot before too. Alrighty. All right, so this is interesting about the yeah, the gonads. What are your recommendations? This is pretty good. So I've already been for years recommending that we no longer do the early spay neuter. And I just read an article that was in a veterinary journal this week that was a research presented article. It was very well written about the ins and outs of this and what they have found. And it listed different breeds that were more predisposed in the male versus the female. Specifically, we're really talking about dogs because of the fact that some of them get bigger and cats are more the same size, but the same type of thing will happen. So this early spay neuter really came about because of humane societies trying to get down to a zero population growth effect because of all the unwanted animals, because of people not being responsible. So it took a number of years before the veterinary industry started to coordinate signs that they were starting to see and diseases in animals that we didn't really see and didn't exist before, and making that connection. So the gonads themselves, one is they are responsible for turning on and turning off many hormones, and also they regulate cytokines. They keep inflammation down in the body. So the early spay neuter removes those mechanisms, and some of them are done so early, like at 8 weeks of age, those bodies never ever had the benefit of any of the gonads, like they never had them at all. And so any of the jobs that would have been there, there's not even a residual bit of help in those early spay neuter. And so dogs that grow more, what they find is by being neutered early, the growth plates don't close when they should. So their leg length gets longer than what it's supposed to. And then that changes the angles of the stifle and the hip and the pelvis. And so it creates then, because of abnormal positioning of those joints, leads to arthritis. So yes, they've linked early spay neuter to allergies, to arthritis, to even cancers in some of them. Um, a lot of problems. And the summary of this article was that they recommend not now until the animal actually has their growth plates fused, and that in some of them is going to be a year and a half or so down the road. So in the old days, the doctor thing always was let them go into heat once and then spay them after that. Wait till they're a little bit older, or the boy dogs, don't do it at all unless they become a problem. That was the program up until probably some of the early spay neuter, like 3 to 4 month, was happening in the 1980s, but we didn't get into this early 2 month type of thing until the 90s and after that. So really think on it, and there are going to be veterinary clinics that are not pushing for the early spay neuters. If you have one that still does, consult with them. Google up some articles on that, or you could take something to them if you like them otherwise, or find a practice that does align more with your philosophy on that. But I think pretty soon, with all the data that we have, it's going to even push the humane societies and the shelters to not demand it, and to give those animals an opportunity to have the benefits of the gonadotrophins and the gonads. And will definitely, again, change the face of what's happening in the veterinary industry, and owners won't have all the problems that they face now. A lot of the diseases that we're treating won't be there any longer. Yeah, and Showtime came in to help. Alrighty. A dog's chronic runny nose and congestion. Okay. So first off, um, leave the thing here until I get it all read, but chronic runny nose. Okay. So are you saying congestion of the nasal cavity? So nose, like a wet nose or drips from the nose, actually means that that individual's parasympathetic system is working. So that can be a good thing because when the parasympathetic system is turned on, that's when your digestion is working well versus a high sympathetic, everything is dry. So if it's just that, now the congestion, that would be like, is it sinus congestion? So that could be something else. Or is it respiratory congestion? Alrighty. Yeah, we don't know that it's usually allergies are more skin related problems in the dogs. I don't, the runny nose is not necessarily a bad thing. They want to do a CT scan to check for cancer, polyps, fungi. That won't necessarily show up on a CT scan unless it's very deep rooted and there's changes in the architecture up inside. We definitely see this in cats that have had the herpes virus early in life, and they'll get damaged turbinates. It happens with pigs as well when they get the rhino. They'll have atrophic rhinitis from a viral infection. So, I mean, I guess it's feasible, depending on the age of the dog, that they could have had something like that as well that damaged the turbinates. We definitely don't see it as much in dogs as we do in cats and pigs. Um, but if your dog is older, now usually if it's a cancer or something like that, you end up with blood in the drainage. It's not just like a clear running nose. And also if there's cancer or polyps, they're snorting because they're trying to get it out of there because it's growing and it's a space occupying lesion. And that's different than damaged turbinates. So a space occupying lesion, like a polyp or cancer, they're trying to snort it out, and generally you get blood. Fungi, those are difficult because they grow so rapidly. And generally, if there's a fungus, the individual is going to be ill. They're not going to act like life is good and everything's great, other than the clear runny nose. With the fungi, it starts taking over and it would get into the lungs fairly quick. And then you would also have like a bronchitis and things like that. But there are different fungi. There's blasto and histo, and those can be more common, like from birds. It's like chickens, ducks. So if you're around any fowl, if the dog goes out in the lakes and ponds and places like that, then it could possibly be a fungi. And it even a radiograph, it would look totally different if there was like fungi up in there than if it was a cancer or polyp. But as I said, with those two, generally they're trying to snort it out. So the clinical signs in the dog is different. So those are some thoughts on it. Alrighty, but the Facebook page is lit up. Alrighty, a 2-year-old Labrador, no history of hip problems, just under 2 days on and off limp with the right hind leg. Okay. Well, so the head of the femur that's a little flat, that's something that's been coming on, and that wouldn't be an acute lameness. I'd certainly be thinking that something happened in the stifle. That's usually the joint it's going to happen. Now they could be running and playing and twist anything or land on something wrong. If there's no soft tissue swelling that you can see, then generally you're looking at something with either the medial lateral collaterals, the meniscus, or those cruciate ligaments inside the stifle, the knee joint. And it can start off as a little thing and it may just been minor and may not show up radiographically because you got there so early that there wasn't time for that greater degree of inflammation to show up. So there's that. Definitely rest is the first thing. If you know for sure what joint it is, then you can always do cool compresses for the first up to 72 hours. And after that, then you switch to warm compress. The pain relievers, fine, because and there you can use a drug, but then there's also MSM, there's Boswellia, things like that to take that soreness off. 2 years old, that animal, that dog is not going to be glucosamine chondroitin deficient. So his chondrocytes are going to be fine. So the glucosamine, that's going to increase the viscosity of the joint fluid and help. But for a 2-year-old that hasn't had the joint opened, that's probably not going to make a difference. I'd be looking at Lake Cathperthes. No, that's going to be typical, and that's generally really only in small dogs like poodles, um, Bijans, ones like that. That would be really rare. Not to say that he couldn't, but really rare. And that actually, it's not a flattening; it's a dissolving of the head of the femur. It looks totally different. So that Google didn't get you anywhere. Yeah, it's less limping, probably because of the pain meds. You just don't want him out there running around right away. Generally, injuries to the knee come about from a torquing. So they're going really fast and all of a sudden, usually chasing a cat or a squirrel or something, a rabbit or something, and then they turn really quick and the front end turns, but the rear leg doesn't turn fast enough. And so it gets a torque or they get body blasted sideways by somebody else. So I would look at the glucosamine, the chondroitin. I mean, sorry, I would look at not those, but look at the arnica, Boswellia, MSM, things like that for inflammation. And then the other thing is that those ligaments, the joint, the muscles, the tendons, they need a lot of calcium and magnesium. 94% of the population is low in that. They have inflammation, which runs out manganese. Manganese is also very key to joint stability. And so I would take your 2-year-old Labrador and do the hair tissue mineral analysis test and find out what's missing and create a healthy, strong body so that this doesn't continue to happen and you don't end up with a torn cruciate and then you have the surgery and then you've got everything else that goes with that, thousands and thousands of dollars. You can be proactive and stop this. That'd be my take on it. Okay, so we're back to talking about life cycles, being in heat, the spay neuter thing. Doesn't going into heat make them really uncomfortable? Looks like to me they're crawling out of their skin. Well, um, it's obviously to them when the first time it happens, it's something different. They don't know. I mean, they do spend a lot of time licking because they can feel it there. Putting the little bloomers and pants things on them helps it trap in that pad so they're not constantly at it. It doesn't mean they like the bloomers that are on. It can make them embarrassed and they don't like that. I don't know if they have cramps like women do. I mean, I guess it's feasible. There could be belly cramps, that kind of a feeling. I don't know that that happens with the dogs. Uh, there is a shift in hormones, so that is a little different to them. They're going to be feeling different, acting different, interacting different with other animals in their environment. But I don't know that I've not seen of all the ones that I've seen in heat, which is a lot over the years. I can't say that any of them acted like they were in excruciating pain or high levels of pain, but it's just different. But also, we're not necessarily saying don't ever spay them. We're just saying let them get old enough to where the likelihood of some of those other diseases, which are long term, lifelong, are less likely to ever get started. And all of those inflammatory cytokine related joint arthritic problems are more lifelong than the one or two that may get a mammary tumor because they didn't get spayed early. I mean, those numbers are like super low. The percentages that get those are low, or the dog with the perianal adenoma because he was intact or whatever. Those numbers compared to all of the population out there are small. But the inflammatory diseases, the arthritis, the allergies, the irritable bowel, all of those percentages real high that you would have a dog that has those. All right, we got a few more minutes here. Any other questions coming in? I can give you a little heads up again about the Life Extend Method program that we're going to be offering after this, that you'd be able to sign up for and join in on that, learn some other things about lifestyle, cancer, um, just a lot of other topics there that I'm sharing with you. And then we'd have another chit chat at the end of that. Uh, I will thank our sponsors again. So we have Turmeric Life as a sponsor and also the Chi Dog. So we appreciate both of them, and there's their websites where you can go take a look at their products and see about supporting them. They may have something that would be just right for your little critter. We have time for one more question. Recommendations for inflamed paws. Changes day to day. Greasy fur. Can't keep him from licking his paws, which keeps the circle of yeast. Yeah, 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 yeah. That keeps that all going. So, so I do soaks. I would do an Epsom betadine soak. So the Epsom salts to help draw out, the betadine is going to help clear up. So I would do those in a warm, and then warm water to dissolve the Epsom salts. It's like a, oh, teaspoon to a tablespoon, which is a kind of a broad range, but it depends on how big your cup is of bowl of water that you're going to put it in. Mix that up with the warm water, add some betadine. So that's one thing. The greasy fur means that this individual has a lot of their seborrhea glands are hyperactive. So I don't know the age of them. There's a lot of things I would look at there. Other things that you can do to help the inflamed paws is aloe vera, topical arnica, topical lidocaine, all of those. There's some things that come in spritzers that you can use on the paws. You certainly want to make sure that anything you put on the paw is safe for ingestion, because that's what they're going to do. I have a little paw spa. It's on my website. If you go into like the articles that have been posted, and there's some information there, a little recipe, which is in one of the books, probably in the Mouth to Bum from my senior dog program. Where you do the soak and then you add some essential oils into there, and there's some of those that you can dilute out. Actually, lavender is a really good antipyretic, but you always want to dilute those oils a little bit. And if you can put them in your bowl of soaps, you could alternate one day with betadine, and another time you could put the essential oils in your soaking pod, your little bowl, and you can do that too. But there's something else that's creating the greasy fur. So depending on the age, any kind of hormone imbalances can create some of that too. I'd be looking at that. Yeast, all of those, they're going to live in this more alkaline environment there. They like the moisture. So being able to dry it is helpful. So things that dry, oh, witch hazel is another good one. So you might take your essential oils and mix them in a spritzer bottle of witch hazel, and then spritzer the feet throughout the day, so you're not having to spend the time soaking. You could do that a couple times a day. So that would be another option. That was a fun one, kind of different. Alrighty. Well, we've come to the end of day 2. I'll be back with you tomorrow, same time, same station, after day 3 of our Pet Pain Summit. And we'll have a lot more fun things to talk about then tomorrow after the program. You've got a lot in store, another really, really good day. And then we'll have some time to talk about those subjects, topics, and anything else that comes up in your universe. So give all your critters a kiss on the noggin from me, and I'll see you back here tomorrow night.